Okay, so when you hear AI in healthcare, what's the first thing that pops into your head? For most of us, it's probably something like robot surgeons, right? Or maybe some super advanced way to diagnose diseases. And yeah, that stuff is incredible. But what if I told you the biggest, most immediate way AI can change healthcare isn't in the operating room at all, but in the back office? We're about to dive into some really fascinating research that shows a huge untapped potential for healthcare to save billions, yes, billions, and get way more efficient just by fixing its basic business operations. It turns out healthcare can learn a ton from places you might not expect, like retail and even the airline industry. So to really grasp just how big this opportunity is, you've got to understand the sheer scale of the spending we're talking about. Get this, in 2023, just in the US, healthcare spending hit, wait for it, $4.9 trillion. Trillion! Let that number sink in for a second. That figure is the backdrop for everything we're going to talk about. It's so huge that even tiny improvements in efficiency can mean saving an absolutely mind-boggling amount of money. All right, so where's all that cash actually going? Well, the cutting-edge treatments in the direct patient care, that's what gets all the attention in the news. But a massive, massive slice of that pie, we're talking as much as $950 billion, goes to all the operational and administrative stuff. Things like scheduling appointments, handling billing, managing supplies, and figuring out staffing. It's like this hidden iceberg of costs, and that's exactly where the biggest opportunity for savings is hiding. And this is where we get to this really strange paradox at the heart of the industry. On one hand, you have medical science that is it's performing miracles every single day. It's absolutely cutting edge. But on the other hand, when you look at the business operations, it's like they're stuck decades in the past compared to other industries. I mean, while other sectors were jumping on AI to make everything run smoother, healthcare has been, well, surprisingly slow to use those same tools for its own nuts and bolts business functions. So what's the deal? Why is this happening? Let's take a look at the current reality, which really comes down to a misaligned focus. It turns out you can't just throw money at new technology and expect it to fix everything. It's not a magic bullet. In fact, a lot of health systems are stumbling right into a trap that experts call the productivity paradox.
And this productivity paradox concept is absolutely key to understanding the problem. Picture this. A hospital invests a ton of money in some fancy new tech. They're expecting it to save them time, save them money, make everything super efficient. But the opposite happens. They actually end up spending more money. The new tech, because it wasn't implemented right, just adds new layers of complexity and new costs, and that big promise of savings, it never shows up.
And if you want a number that perfectly shows this paradox in action, here it is. A recent study found that only 61% of US hospitals, just 61%, bother to do any kind of local performance testing on their AI models before they go live. Think about that. That means almost 40% of them are just rolling out these super complex, expensive tools without even checking if they'll work in their own unique hospital environment. It's a total recipe for failure, for disappointment, and for wasting a whole lot of money. And this is the good news, it absolutely does not have to be this way. So if that's the problem, where do we look for the solution? Well, to see what's really possible, we can just look at the blueprints left by other industries. I'm talking about sectors like retail and aviation. They faced a lot of the same pressures, and they used operational AI to totally transform how they do business. And they unlocked some seriously incredible value along the way. Okay, so lesson number 1 comes from the world of retail and manufacturing. For these guys, efficiency is everything. They literally live or die by how well they can forecast demand, manage their inventory, and keep their supply chains running smoothly. And guess what? They've been using AI to nail this stuff for years. And the results? They are just staggering. Check this out. The German retailer Otto used AI to forecast what they needed, and they cut their inventory by 90%. 90! We all know UPS, right? Their AI that optimizes delivery routes saves them up to $400 million every single year. And Boston Scientific, they put 50 grand into an AI quality control system and got $5 million in savings back. The point here is, we're not talking about small tweaks. This is game-changing, transformational stuff. Okay, now just for a second, imagine taking that same level of obsessive, ruthless optimization and applying it to a hospital. What if you could manage the flow of life-saving medical supplies, or optimize the operating room schedule, or predict a surge in ER patients with the exact same precision that Amazon uses to run its warehouses? The potential to cut waste and actually improve patient care is it's immense.
All right, our second big lesson comes from an industry you might not expect, aviation.
When you think about it, it makes perfect sense. Just like healthcare, aviation is an industry where safety and efficiency are absolutely non-negotiable. And they have masterfully woven AI into pretty much everything they do, from managing air traffic and scheduling maintenance to dealing with bad weather.
And the parallels here are just brilliant. For example, Delta uses AI to predict weather problems so they can minimize delays. Well, couldn't a hospital use a similar model to predict a huge surge in patients during flu season? Absolutely. Southwest Airlines uses AI to predict when a plane part might fail before it breaks. Well, why can't a hospital apply that exact same logic to its super expensive MRI machines to prevent them from going down unexpectedly? It's the same principle.
So it's one thing to see what's possible, right? But the real question is, how do we actually get there? Well, the great thing is, this research lays out a really clear step-by-step roadmap for healthcare leaders. And it makes it plain. This isn't about just buying more tech. It's about having a real strategy. It boils down to 4 key steps. First, you have to actively fight that productivity paradox. That means you measure everything. You have to know the real return on investment for any AI tool you bring in. Second, you've got to get your AI operations team and your research team talking and working together, creating a system that's constantly learning. Third, and this is a big one, everyone in the organization needs to understand AI basics, not just the IT folks. And finally, leaders need to push for clearer policies and regulations from the government to help guide all of this.
And all of this really leads us to the main event, the big conclusion. The single biggest challenge here isn't the technology. It's not technical at all. It's organizational. This isn't about trying to cram a new piece of AI software into an old, clunky process and hoping for the best. No, it's about completely redesigning the system around the AI.
There's a quote from the paper that just nails this whole idea perfectly. It says, "Rather than forcing AI tools to fit into our current clinical workflows, we must redesign our health systems to generate value through AI." I mean, that's it right there. Stop trying to make the tech fit the old, broken workflow. You have to rebuild the workflow to take advantage of what the technology can actually do. So I want to leave you with a question to think about. When you look at your own organization or just the health systems you're familiar with, what do you see? Are they just trying to shoehorn AI into old ways of doing things, basically crossing their fingers and hoping for a different result? Or are they being brave enough to tear down those old processes and redesign them from the ground up to really truly unlock the power of AI? Because the answer to that question is probably going to decide who wins and who loses in the next chapter of healthcare.